Morning. I'd like to acknowledge the traditional owners and the people that are visiting in this country today. When we first started PEPA, which started in 2003, we used to do workshops for specialist palliative care services in Aboriginal perspectives of palliative care. In 2008, the government identified that Aboriginal and Torres Strait Islander health workers were to become a priority in our training. So PEPA sought to put together an advisory body to advise them about the best way to do that. So the first thing that we identified is talking about palliative care wasn't necessarily culturally appropriate for Aboriginal communities. What we did know is that we dealt with chronic illnesses and advanced illnesses that were unlikely to get better, and that's how our community and health workers related illness to people. So the program experience in the palliative approach, it would be better if I could stand this way, is free and accessible education and training for all health professionals. So we aim to improve your knowledge, skills and confidence to work with people with palliative care needs or at the end of life. We provide opportunities for palliative care providers across the continuum. So the only people we don't provide training and skills assessment for currently is specialist palliative care services. So anybody else from any other stream, primary, secondary, even tertiary facilities, so long as you're not in a specialist palliative care for service. So we provide experience-based learning opportunities, incorporating best practice teaching and learning in palliative care. And the palliative approach, for anybody that doesn't know, is an approach that improves the quality of life of patients and their families facing problems associated with the life-threatening illness throughout the prevention and relief of suffering by means of early identification and impeccable assessment and treatment of pain and other problems, physical, psychosocial and spiritual. When we talk about the palliative approach, realistically, we shouldn't even need to talk about cultural matters because everything should automatically be person-focused. So our patient is our focus, so whatever they identify is our priority. Just quickly, a palliative care team approach can include a whole lot of people and generally does. So this shows you a little bit of a diagram of all the kind of people that can be involved in a palliative care approach, and the more people the better, or the less the better. It depends on what the patient and the family identify that they need. PEPA for all health professionals, we have a variety of workshops that health professionals can attend. So we have 2 streams, workshops and placements in specialist palliative care facilities as part of the experiential learning pathway. So the workshops we have are palliative approach workshops, and they can be done for nurses, allied health professionals and general practitioners. Then we have community outreach programs, and they're programs that we take into Aboriginal or Torres Strait Islander communities and are run in an Aboriginal community, and both Aboriginal health workers and Aboriginal community can attend those workshops to grow people's knowledge about a palliative approach. And then we have culture and diversity workshops. They're 2 workshops. One is about Aboriginal culture and Aboriginal perspectives of palliative care, and the other one is about cultural diversity and cold communities in Australia. All of our programs have resources and learning guides that go with them. If you do a workshop, you get a learning guide that goes with that. If you do a clinical placement, you access online learning, and you still get a learning guide that goes with that as well. Our clinical placements are 2 to 5 days. You do need to put in an application for your clinical placements, but I really haven't seen many of them that have ever been refused. In your clinical placement, you'll go to a specialist palliative care facility, and you will more than likely see a variety of where palliative care is provided in that community. So you might spend a day in the palliative care service, you might spend a day at community palliative care services, you might spend a day at the hospital palliative care service. So you might go to all the different environments and experience palliative care delivered from those service aspects. PEPA is a national program, so we run in every state and territory. Every state and territory has a PEPA manager, and most of our states have Aboriginal project officers that help support run the program as well. We have a program for Aboriginal health workers that when we created it was underpinned by the cultural respect strategy that Queensland Health distributed back in 2009, I think, or 8. So we had a small Indigenous PEPA reference group back then, and it's quite large now. The reference group contains membership for every different health professional body or healthcare providers, representatives of healthcare providers for Aboriginal people. So we have ADA, CATSN, the Allied Health Professional Body, we have education sitting on there. So the membership is about 21 people at the moment on the reference group, and they still direct everything the program does for Aboriginal people to make sure it's still current and relevant. So we make sure that communicating is done in a sensitive way that values cultural difference, and we try to link that throughout the whole PEPA program. We provide information and training to all staff to ensure the principles of cultural respect are applied, and throughout the states and territories we've engaged Indigenous organisations and personnel in the planning and delivery and evaluation of PEPA. So we have established good networks and unique networks in every state and territory depending on what the model of care is for those communities. Every state and territory is different, so every model that we use throughout Australia is different in each state and territory as well. We created some culturally appropriate resources for the Indigenous health workers, so that meant changing the notion of palliative care when we talked about it in brochures to promote. We also did up a program for Indigenous health workers because, as you can see and you've heard, there are very few Aboriginal health workers that work specifically with palliative care, although a lot of health workers do it every day in their work with chronic care patients. So we created a special program for Aboriginal health workers to grow their knowledge about palliative care and the variety of tasks involved in the role when you're helping coordinate or work with a larger team in delivering palliative care services. We also did communication guidelines for the health professionals that work with us in PEPA so that they would be able to communicate better with everybody. And because we have specialist palliative care placements, and those placements come with a mentor for the 2 to 5 days that you do your placements, we wrote some mentoring guidelines to help the mentors for those placements to be able to engage better with the Aboriginal participants. Just recently we reviewed the program and the Aboriginal health worker learning program that we had. We decided to revise because there was a new resource brought out, PEPA the comic, palliative care comic. So we decided to align the training and education with that comic. So a new program has just been written for health workers, and we should be doing that horrible word, piloting that sometime next month. To do a placement with palliative care services, it's probably the most important to know what you've done before in this work area. And I guess had identified that there wasn't really good forms, or the information that we'd gotten from participants previously wasn't really of that good a quality, so we weren't really sure if they were getting what they wanted out of the placements, because it's different for everybody. So we've created a little bit of a form to give people more of an idea about things that happen in a palliative care service and see what people would like to participate in. We've had some placements that came in for placements, and while they were in a specialist palliative care service, there were some clients that passed away. So as the nurses went to take a body away and to go and clean that body, wash it down and lay it out properly, a placement participant was offered to go that way and go with the nurse and do what she did. And unfortunately, for some of our participants, our Aboriginal participants, it might not be appropriate for them to, playing with dead bodies is the wrong word to use, but it might not be appropriate for them to go and participate in that activity. So we've included that in this form to see if it's appropriate for people to be doing that or not, or even to the fact of if they've ever seen a body of somebody who's passed away before, because that's quite shocking for some people. So PEPA has been active for the last 10 years. We've put through 317 placements of health and community professionals. We've done 245 Aboriginal and Torres Strait Islander placements. And we've had 755 educational workshops delivered to 16,383 people, and 983 of those were Aboriginal and Torres Strait Islander health workers. We've just received funding for another 6 months, so we'll be operating this program at least until the 31st of December, and hopefully longer after that, because there's still a need. There's not another program out there that provides palliative care education and training to health professionals, and there's certainly not another training facility, a training course that does this and provides placements in specialist palliative care services. The little map up in the top corner is the percentage distribution of Aboriginal and Torres Strait Islander people in each state and territory of Australia. And when we break down what we do, we consider that, because each state and territory, although we might have that particular percentage base of population, we might not necessarily have the health services or health staff to service that. So some of our participant comments. I'm able to talk to the GP about the need for medication. Probably the other biggest thing that we've recognised since this is people never used to ring specialist palliative care services, even GPs in the community. They would muddle through with their palliative patient when they could have quite easily rung a specialist facility and got some advice on how to support a patient at home. And until they've done our program, they didn't realise how easy that would be. And I never envisaged that there would be barriers like that between GPs and specialists. Silly me. PEPA's given me the confidence in communicating and delivering quality services to our clients. I know who to ring in palliative care now for information about our patients' palliative care needs. It was good to see where our mob goes when they come here. I'll be better able to assist clients or loved ones as they go through their final stages of life. My mentor explained the roles and responsibilities within the palliative care team and in the service and out into the community. So it's nice to have people know. That's another major thing that we do in placements. So I guess participants learn about the variety of roles, and every specialist palliative care service is different with the roles, the positions that they have, but learning what each one of those, the role of each of those persons do in the facility allows people to know the diversity of services that can be delivered. I think that's about it. Oh, if you want to find out more, you can go to pepaeducation.com and it'll have a site there. You can go to the state or territory where you live, and click on that and it will give you information about the PEPA manager and the Aboriginal project officer for your area.